I want to start by telling you that the word superfood is not a scientific term. There is no medical definition of it. There is no list that a committee approves. It is a marketing word, and it was invented to sell things. In fact, the European Union restricted the use of that word on packaging years ago because products carrying it could not support the claims they were making. So I am not going to give you superfoods, but I am going to give you something better and more honest, because most nutrition advice takes months to show anything. And I understand why that is discouraging. You change how you eat, you wait, and nothing seems to happen. There are, however, a small number of foods where the effect is genuinely fast, measurable in hours or days in controlled trials, not in testimonials. There are three that I would put in that category, and I am going to be equally honest about what does not work quickly, which is almost everything else. At the end, I am also going to tell you about a harmless side effect of one of these foods that sends people to the emergency room every year. And more importantly, when that same appearance is not harmless at all. Please stay for that. Let me start with the fastest one. Number one is beetroot, or any nitrate-rich vegetable. The speed here is genuinely striking. Studies measuring blood pressure after a single dose of beetroot juice find the effect appears within about 2 to 3 hours, not weeks, the same afternoon. Here's the mechanism, and it involves your tongue. Beets, arugula, spinach, celery, and lettuce are rich in dietary nitrate. Bacteria living on the surface of your tongue convert that nitrate into nitrite. Your body then converts nitrite into nitric oxide. Nitric oxide is the signal that tells the muscle in your artery walls to relax, which widens the vessel and lowers the pressure inside it. And here's why this matters more for older adults specifically. Your body's own internal production of nitric oxide declines steadily with age. In a 2025 study from the University of Exeter, adults in their 60s and 70s who drank concentrated beetroot twice daily for 2 weeks saw blood pressure fall by roughly 7 points. Adults under 30 in the same study saw essentially nothing. The dietary route matters more precisely because the internal route has weakened. Now, 3 cautions, and the first one is important. If you are already taking blood pressure medication, adding a strong daily nitrate load can drop your pressure lower than intended. Dizziness on standing leads to falls, and falls at 75 are serious. Talk to your doctor before making this a daily habit. And consider checking your pressure at home for the first couple of weeks. Second, if you have chronic kidney disease, beets and leafy greens are high in potassium, and your intake should be set by your doctor rather than by a video. Third, and I mentioned this in my video on arteries, strong antiseptic mouthwash kills the tongue bacteria that make this whole process work. You can eat the beets and block the pathway with the rinse. Number 2 is kiwi fruit. And this one has better evidence than most people would ever guess. In 2021, researchers at the University of Michigan published a randomized comparative trial in the American Journal of Gastroenterology. Patients with chronic constipation were assigned to one of 3 natural treatments for 4 weeks: 2 green kiwi fruit a day, or 100 grams of prunes, or 12 grams of psyllium. All 3 significantly increased the number of complete spontaneous bowel movements. But the details favored the fruit. Stool consistency improved significantly with kiwi fruit and prunes. Straining improved with all 3, and most strongly with kiwi fruit and prunes. The kiwi fruit group was the only one to report significant improvement in bloating. Side effects were most common with psyllium and least common with kiwi fruit. And at the end of treatment, fewer patients were dissatisfied with kiwi fruit than with the other two. Later international trials have confirmed that 2 green kiwi fruit daily improve constipation and abdominal comfort. Most people begin noticing a difference within the first several days. Why does it work? Kiwi fruit contains both soluble and insoluble fiber. It holds water unusually well, and it contains an enzyme called actinidin that appears to aid digestion and gastric emptying. Now, why does this matter so much at 65 and beyond? Constipation becomes far more common with age, and it is a bigger problem than most people acknowledge. It is one of the most common causes of bloating in older adults. Many medications cause it, including opioid painkillers, iron supplements, and certain blood pressure drugs. And straining is genuinely not harmless in an older person with cardiovascular disease. Eat the skin if you can tolerate it, since that is where much of the fiber sits. 2 cautions. Kiwi is a common allergen, particularly in people with latex allergy, and reactions can be significant. And kiwi fruit is relatively high in potassium, so again, if you have kidney disease, ask first. Number 3 is fermented dairy. Kefir, or plain yogurt with live cultures. The reason I include this one is that people often notice a difference within days, and the honest explanation is not what most videos say. Lactase, the enzyme that digests milk sugar, declines with age in most of the world's population. Many people who tolerated milk at 40 do not at 70, and they have no idea that is what changed. Fermented dairy contains bacteria that partially digests the lactose for you, which is why people who bloat from milk frequently tolerate yogurt and kefir comfortably. If dairy has started bothering you in recent years, switching to fermented forms is a genuinely fast experiment with a clear answer. The longer-term picture is separate. In a randomized trial at Stanford published in the journal Cell, 10 weeks of a high fermented food diet increased gut microbial diversity and lowered 19 inflammatory proteins in the blood. But notice the timeline there, 10 weeks, not days. The immediate benefit is digestive comfort. The deeper benefit takes time, and I am not going to blur the two together. If this honesty is useful to you, tell me in the comments which of the 3 you are going to try. I read them. Now the part I promised. Beets can turn your urine pink or red and your stool a deep reddish color. Doctors call it beeturia, and it affects a meaningful minority of people, more commonly those low in iron. It is completely harmless and it passes within a day or 2. But every year, people see red in the toilet, panic, and end up in an emergency department. So if you have just eaten beets, that is very likely the explanation. Now, the far more important half of that sentence, if you see blood in the stool and you have not eaten beets, that is not something to explain away. Bright red blood or black tarry stool needs to be evaluated. Please do not spend a week hoping it was something you ate. And a few other patterns that mean a phone call rather than a grocery run. A persistent change in your bowel habits lasting more than a few weeks. New constipation that is unusual for you, particularly with abdominal pain, vomiting, or inability to pass gas. Unexplained weight loss. Constipation alternating with diarrhea. And a stool that has become consistently narrow. Colorectal cancer risk rises with age, and it is treatable when found early. If you have not had colon cancer screening, that is worth asking about at your next appointment. Now, let me be honest about what does not work in days, because I think you deserve the full timeline. Cholesterol takes about 6 to 12 weeks to respond to diet, which is why doctors retest at that interval. Blood sugar, as measured by A1C, reflects roughly 3 months. So testing sooner tells you very little. Weight and body composition change over months, and changes faster than that are usually water. Inflammatory markers took 10 weeks in the Stanford trial, and bone density is measured in years, not months. So if a video tells you a food will transform your cholesterol in a week, that is not how the measurement works. Never mind the biology. 3 honest statements before I close. Superfood is a marketing term, not a medical one. These 3 foods have specific, narrow, well-documented fast effects, and none of them transforms your overall health in days. And this video is education, not medical advice. I am a physician, but I am not your physician. Here is what I would actually say to a patient. The reason I like these 3 is not that they are magic. It is that they give you feedback quickly. Most healthy changes are invisible for months, and that is precisely why people abandon them in week 3. Something that works within days gives you a reason to keep going. Beets can lower your blood pressure this afternoon. Kiwi fruit can make you comfortable this week. Kefir can tell you within days whether dairy has been the problem all along. Use them as a beginning, not as a destination. And then be patient with everything else, because the things that matter most are the slowest to show. Tell me in the comments whether you have ever had bituria and wondered what on earth was happening. I suspect a few of you have a story. Take care of yourselves, and I will see you in the next one.